So friends, we are now starting with the biochemistry chapter, that is topic name is fatty acid, fatty liver disease and the atherosclerosis for first year. In this we are only talking about the first year. What are the main things we must know in the first year about fatty acid disease and atherosclerosis? First of all, you must understand what is the fatty liver. Fatty liver is like accumulation of fat in the liver, and atherosclerosis is, what is atherosclerosis? Atherosclerosis is in the blood vessels. There is accumulation of that fatty layer, fatty things. So what how the fatty liver comes, and what are the stages, and what are the causes, how it is caused, fatty liver. In this we have to know. First of all, starting with the fatty liver stages and cause. We talk about fatty liver stages. Fatty liver, what are fatty liver? Fatty liver are lipid as triacylglycerol. Fatty liver are lipid as triacylglycerol accumulated in the liver. It is obviously accumulated inside the liver. It is also known as AKMS, also known as non-alcoholic fatty liver disease. In short form, we can say that NAFLD. In short form, we can say NAFLD. And now nowadays we are using new term, that is MASLD, that is metabolism associated with steatotic. Steatotic means it is like fatty things, you know. Metabolism associated with steatotic liver disease. Metabolism associated with steatotic liver disease. You have seen this. Now we are talking about the stages of progression. In this we are having two stages. How many stages we are having? We are having two stages. That is reversible stage, and another is irreversible stage. Now if we talk about the reversible state, in reversible state we are having three stages, that is steatosis, hepatis and fibrosis. In irreversible, that's cirrhosis. Okay, so first of all we are talking about reversible. In reversible, fatty accumulation, non-acid steatosis, non-alcoholic steatosis. First of all, there is first of all, if we are having a liver, in the person, the liver, there is fatty accumulation. What is there? There is fatty accumulation, non-alcoholic steatosis. Then what happen if in the person liver there is fat accumulation, and then start the second stage of progression, that is fat accumulation and inflammation. There is inflammatory pain like things, pain are happening, so there is fat accumulation and inflammation, that is a second stage, hepatitis, non-alcoholic. This stage also called as non-alcoholic hepatitis. Next, then there is scar means there is roughness type appearance on the tissue. This is third stage and last stage of reversible, that is appearance of a scar tissue. That is third stage, fibrosis. So next we move to the third irreversible stage. We are having irreversible scarring, that is cirrhosis. Third irreversible cirrhosis, that is there is this after this stage is irreversible. Then because scarring has happened much more, there is roughness around the liver, and that it is much more. Then next step is the hepatocellular carcinoma. It is a carcinic, and so this is the last stage. And you understood what are the stages of progression of the fatty liver. First of all, there is fat accumulation, then the fat accumulation is there, then there is inflammation. After that there is scar formation, scar tissue, that is roughness on the tissue. Then irreversible stage start, that is irreversible scarring, more scar is there. Then after that there is hepatocellular carcinoma. And next we are seeing about what are the causes. Basically, what are the causes behind the fatty liver? There are basically two causes. First of all thing is that there will be more production of triacylglycerol. Two things can happen. Triacylglycerol, if we triacylglycerol is what? It is break into two things. That is fatty acid and glycerol. So triacyl, why there will be the fatty liver? Fatty liver will be due to the increased amount of triacylglycerol. How there will be increased amount of triacylglycerol? First is that there is more synthesis of triacylglycerol. Another is that there is no export of triacylglycerol from the liver. Obviously, two things can happen: more triacylglycerol will be produced. Another is that there will be no export or lesser export outside liver. So first of all, we will discuss in two cases. Causes we will discuss in two things, that is increased triacylglycerol. Next, we will discuss about the decreased export of triacylglycerol. So increased triacylglycerol is we take excess carbohydrate. If a patient take excess carbohydrate, and another can be the person is diabetic, and diabetic mellitus is written here, and person is insulin resistance. Insulin resistance, three cases are there: excess carbohydrate, if a person is taking more and more carbohydrate; another is insulin resistance; third is diabetes mellitus. First of all, we see about the excess carbohydrate diet. We will discuss each by each. Not take attention, just chill and just enjoy the lecture, and you will understand what I am trying to say, and you will understand the whole this thing that is important for first year. So excess carbohydrate diet. If you take the excess carbohydrate, if there is more carbohydrate we are taking, then there will be increased glycolysis. There will be increasing glycolysis. If they increase glycolysis, there formation of pyruvate. In glycolysis, what happens? Glycolysis is basically conversion of glucose from glucose to pyruvate. They increase pyruvate, and this will go into formation of acetyl coenzyme A, building block of fatty acid. What is acetyl coenzyme? It is a building block of fatty acid. So in how acetyl coenzyme will form, that is pyruvate dehydrogenase, irreversible. So pyruvate dehydro step is irreversible. Only want to say how I am saying that how acetyl coenzyme is formed. Acetyl coenzyme is formed from pyruvate and pyruvate dehydrogenase. So next, acetyl coenzyme is building block of fatty acid. So acetyl coenzyme, then acetyl coenzyme A, it will form next thing will form fatty acid. In fatty acid, in the presence of glycerol, it will form triacylglycerol. Fatty acid in presence of glycerol, it will form triacylglycerol. So another is, first we have talked about the excess carbohydrate diet. Second, we are talking about the insulin resistance. That is insulin resistance. Do you understand the excess carbohydrate? In excess carbohydrate, how triacylglycerol is formed inside? How triacylglycerol is formed? Excess carbohydrate, glucolysis, pyruvate form, then the increase of triacylglycerol. In these are steps how triacylglycerol is formed. Now we move to the next step, that is insulin resistance. If a person is insulin resistance, what it means by insulin resistance? Insulin resistance basically means that the patient insulin receptor are not receptive toward insulin. Insulin receptor are not receptive toward insulin. That insulin inhibit hormone sensitive lipase. So now, if insulin resistance is there is this causes increased activity of basically if there was an insulin now, then there will be the inhibit hormone sensitive lipase, then we have no problem. But a patient receptor is not receptive now. So insulin resistance is there, they increase activity hormone sensitive lipase. If they increase activity hormone sensitive lipase, then triacylglycerol, in the presence of hormone sensitive lipase, triacylglycerol will break into glycerol and fatty acid. Triacylglycerol break into glycerol and fatty acid. Now fatty acid triacylglycerol will break into glycerol and fatty acid. So there is free fatty acid in blood. So now we are talking next thing, that is in deposition in there are two cases: deposition in liver and deposition in blood. First of all, we talk about liver. If fatty acid is what happen in liver, fatty acid is re-esterified with glycerol. Free fatty acid is re-esterified with glycerol, then from the triacylglycerol deposition that causes a fatty liver. What it causes fatty acid liver? Another is in blood vessel. What will happen if in blood vessel in smooth muscles Blood vessels is form of what? It is form of smooth vessels. Blood vessel is form of smooth vessel. In if there is increased free fatty acid in in blood vessels also, fatty acid is re-esterified, and from TAG, that is triacylglycerol, is deposited, and that can cause lead to atherosclerosis. So that can lead to the atherosclerosis. Uncontrolled diabetes mellitus increase hormone sensitive activity. Uncontrolled diabetes mellitus lead to the increase hormone sensitive lipase. So now till now we have discussed about the increase triacylglycerol. Now we are going to discuss about the second part, lack of export to triacylglycerol. Means there is no export of triacylglycerol. First of all, in this there is endogenous production of triacylglycerol. What basically normal thing what happened, that it is carried to VLDL, like very low density lipoprotein. I have written with pencil. So endogenous triacylglycerol carried by VLDL, adipose tissue and peripheral organ. So now VLDL, what is VLDL? VLDL is a lipoprotein triacylglycerol plus apoprotein. Lipoprotein. What is VLDL? Simply, VLDL is lipoprotein, and what is inside the lipoprotein? It is triacylglycerol plus apoprotein. Second, how there is, why there is a lack of export of triacylglycerol. So now decrease apoprotein synthesis. Now starvation, that is in case of starvation, catabolic state, no protein synthesis not there. Apoprotein is basically made up of protein. If there is no synthesis of protein in case of starvation, then decrease activity of apoprotein synthesis. Again, protein, if there is no protein, there will be the malnutrition. Most important malnutrition we have studied, that is a protein energy malnutrition, like Kavaskar. So next we are talking about toxin. What are the toxins we are having? We are having toxins such as carbon tetrachloride, CCl4, lead, Pb, mercury, Hg, and puromycin. We are having 4 toxin. What are toxin? 4 toxin: CCl4, mercury, lead, and puromycin. Do you understand that what is happening? Why, if there is endogenous triacylglycerol in the presence of very low density lipoprotein, adipose tissue and peripheral organ, but first of all, why there is lack of export of triacylglycerol? It required what it required? Apoprotein, but apoprotein is not there in case of starvation. In case of starvation or in case of protein energy malnutrition, there is no protein, then there is no synthesis of apoprotein, so there is lack of export. And we are talking about toxins. So now we next move to the next part, that is loss of lipotropic factor. Another is, third point is lack of lipotropic factor. Lipotropic factor help in excretion of triacylglycerol from liver. What do the lipotropic factor do? Lipotropic factor help in excretion of triacylglycerol from liver. In that we are having the chemicals such as choline, betaine, vitamin E. And if you talk about vitamin E, methionine, and selenium, omega-3 fatty acid, pyridoxine, and pentanoic acid. We will little more discuss about see here, we will little more discuss about methionine and selenium. Methionine is a adenosyl methionine. Decrease available adenine, prevent synthesis of ATP. Decrease availability of adenine. If there decrease availability of adenine, then there will be prevent the synthesis of ATP. Selenium complementary to, what is selenium? Selenium is a complementary to vitamin E. That is so another is omega-3 fatty acid, example alpha linoleic acid. What I am trying to say in third point, that is loss of lipotropic factor. Lipotropic factor, what does lipotropic factor do? Help in excretion of triacylglycerol from liver. What does the lipotropic factor do? It help in excretion of triacylglycerol from the liver. Triacylglycerol को remove करने, it help in removing. So what are the things which are there? That is choline, betaine, vitamin E, methionine, adenosine, methionine, Another decrease activity of available adenine prevent synthesis of ATP. Another selenium. It is complementary in vitamin E. Omega 3 fatty acid. Example alpha linoleic acid, pyridoxine, and pentanoic acid. Now next we move to the atherosclerosis. Yes. Atherosclerosis is a very simple thing. Understanding atherosclerosis is what? It is in blood vessels. What happened? Blood vessels, there is fatty acid deposits, fatty things are deposited. That it is a chronic progressive disease with plaque build up within arteries. In blood vessel there is a plaque formation, that is atherosclerosis. What is plaque? What is plaque is, you understand that there is things like this is blood vessel and there is accumulation of substance here in the blood vessel, so there will narrowing of blood vessel, that is atherosclerosis. This thing is plaque. And what is plaque is made of something. It will obviously it will made of something, that is triglycerol, cholesterol, and other substances. Plaque is made of triglycerol, cholesterol, and other substances. What are the risk factor? What are the risk factor that make blood vessel atherosclerotic? So the things, first of all, what a risk factor, that is modifiable risk factor, something we can modify. Actually, something we can change in our life, and something or we can't change in our life. The modifiable risks are we can change. That is something we can modify. That is, first of all, we are talking about dyslipidemia, abnormal lipid profile. We can decrease the lipid up to the certain. We can change the smoking and tobacco consumption. We can decrease our blood pressure by doing physical activities, and decreasing our sedentary lifestyle. We can change, increase intake of junk food. So increase dietary intake of junk food and processed food. We can access alcohol consumption. Here it should be decrease. We can decrease dietary intake of junk food. Another is a stressful life, lack of sleep, obesity, and underweight. Here should be downward. Decrease. We can change this thing. Obesity, we can become slim, so that we can there will be less chance of in blood vessel. We have to as atherosclerosis, so that atherosclerosis cannot form. This is the risk factor which we can modify. Another is non-modifiable risk factor. Non-modifiable risk factor are age. With the age, there is plaque build up. More time, if a person is fatty, then more build up. Then there will be the age factor. Sex. So male is more prone to atherosclerosis than female until menopause. Till menopause. After that, both are equally prone to the morphine. Another family history, early heart disease or stroke, genetic predisposition. It is having genetic predisposition. It is family history. Genetic polygenic factor influence gene of lipid metabolism. Polygenic factor, it is genetic. If it is genetic, then normal, which we can't change. We can't change our age. We can't change if you think that it is not modifiable. We cannot change our family history, genetic, and race and ethnicity. Few ethnic group have more prevalence of the atherosclerosis. Consequences. What are the consequences of the atherosclerosis? Consequences: coronary heart failure, coronary CHD, coronary heart failure, arrhythmia. Means what is arrhythmia? Arrhythmia is basically not regular interval in no. What is arrhythmia? Basically, arrhythmia is like not at regular interval. Blood is in PQRS complex. You see PQRS complex. There is no interval of regular interval. It is arrhythmic. Another is cerebrovascular accident. Another is peripheral vascular disease. So consequences, what are the result? If we not change our habit, not non-modifiable change, so it can be excused that it is there. But if we don't change our habit, then we will be in problem, like coronary heart failure, arrhythmia, cerebral vascular accident, peripheral vascular disease. Another is biomarkers. We talk about how we will identify that this is the problem. The biomarker, we are having 4 biomarker, that is lipid profile biomarker, apoprotein we have already discussed, apoprotein, inflammatory marker, and other marker. In lipid profile abnormality, they increase lipid, they increase low density lipoprotein. If there is if lipid, then low density increase lipoprotein, high density lipoprotein decrease, and the increase of the total cholesterol triglyceride. Second, apoprotein increase lipoprotein B, decrease apo A1. Third is inflammatory marker. Inflammatory marker, high sensitive C reactive protein, interleukin 6 and tumor necrosis factor alpha, TNF alpha. Another marker is hemocysteine, lipoprotein A, oxidized LDL and fibrinogen. I am repeating again. We are having 4 biomarker, that is lipid profile abnormality, lipid profile abnormality, that is what will happen when they atherosclerosis. They increase LDL level, decrease HDL level, increase total cholesterol and triglyceride. Another is apoprotein, increase apoprotein B, decrease apoprotein A1. Inflammatory marker, that is high sensitive C reactive protein, interleukin 6 and tumor necrosis factor alpha, TNF alpha. Other marker, what are the other markers? Homocysteine, lipoprotein A, oxidized LDL and fibrinogen. Hope this you understand. This only we have to understand in first year. In next year, obviously it is not only thing. This is not so much topic that it will complete in 20 minutes, but thing that in first we must know this only. This are the essential. So I'm again repeating, I'm sort of summary, then I will phrase it. In biochemistry we are talking about the fatty liver. What is fatty liver? It is accumulation of fat inside the liver. Atherosclerosis, fatty liver stages and causes fatty liver. Lipid are triglycerol accumulate in the liver stages. Therefore the stages are divided into two parts, that is reversible and another is irreversible. That is fatty accumulation stasis, not alcoholic stasis. In reversible we are having 3 things, that is stasis, hepato and fibrosis. Irreversible we have cirrhosis. When the causes, what are the causes? There are 2 causes. What are 2 causes? Tell me, yaar. You are studying and you are not telling me, yaar. 2 causes: increased triglycerol synthesis and another is not exporting of triglycerol. So excess carbohydrate diet, if you are taking more food, and insulin resistance, uncontrolled diabetes mellitus. Diabetes mellitus can also cause uncontrolled diabetes mellitus. More diabetic person, increased blood glucose level, and that kind of sort of thing. Insulin resistance. Another uncontrolled diabetes mellitus, endogenous, decrease aponeotic synthesis, starvation. In starvation, what happens? There is no synthesis of protein. Then how apoprotein will form? So there will be decreased activity of apoprotein synthesis. So lack of export will occur. There will no export occur. Toxin we have discussed, that is CCl4, mercury lead, puromycin. Another is loss of lipotropic factor, that is choline, betaine, vitamin E, methionine in adenosine. Another is atherosclerosis. What is atherosclerosis? Atherosclerosis is basically chronic atherosclerosis in blood vessel. There is fatty thing deposited. So that atherosclerosis is a chronic progressive disease with plaque buildup within artery. There is plaque buildup within artery. It is chronic and progressive disease. If you not take care of that, if you not reduce our fat, there is more buildup. That cause very risk factor. It is very there are two risk factors, modifiable, which can modify our lifestyle, such as sedentary lifestyle, lack of sleep. We can more what factor that we said. Another obesity. If you take more junk food, increase dietary and processed food. So if we decrease dietary intake, if we decrease the junk food, then we can improve our activity. The non-modified factor, age, sex, family history, we can't change. So another consequences will be coronary heart failure, arrhythmia, the palpitation like you understand arrhythmia like palpitation type. Biomarker, we are having biomarker like lipid profile abnormality, apoprotein, inflammatory and other marker. In lipid profile abnormality, obviously they increase low density HDL. So there are two things you were knowing. That is first thing is like LDL and HDL. If they increase LDL, it is problematic, and if they decrease, if there is increased HDL, if the LDL is increased, then it will be problematic, and if they increase HDL, it is a good thing. HDL is a good, LDL is bad. So decrease LDL is a decrease, so it is bad for us. Apoprotein we have discussed, inflammatory. Other marker, that is homocysteine, lipoprotein A, oxidized LDL, fibrinogen. Hope this topic is you have understand, and you can find this PDF in my Telegram channel, which is provided in description. Hope you like this video, subscribe to my channel, and bye bye. Take care, bro.